Hello, everyone. I think a lot of people got the brochure, a little bit about my background. And when Jacqueline was speaking about my history in medical, my family has, I would say, you could say almost a century of medical all over the world. I have quite a few doctors in my family. Once you put 20, it's more like 40 doctors in the family. And we know what it's like in not only worldwide, but here in the United States, back from the 1950s and 60s to start healthcare clinics, also healthcare products, and just the overall healthcare industry. For example, my dad is an MD, PhD. He created Bextra that was on the market. So I understand pharmaceutical side. I understand the actual clinical from everything when I was a little boy, sitting in clinical offices and doing paperwork because I was 10, 12 years old and it was free labor. Got into the investment banking when I was young and have been working with medical companies for decades. Myself, I started my first medical practice a few years ago in Anchorage, Alaska. My business partner on the banking side and business consulting, Mike Baker, started Sleep Centers of Alaska, Sleep Centers of Texas, and Denali Healthcare. Been with him through that, and we are doing some innovative products. I should say, without putting too much, we're working on something right now in the healthcare field, and that's because of what's going on in the current environment, not only in Alaska, but across the country. And I wanted to speak today about starting a business, how it works, what you need to do. And this is more Alaska based and what we ran into and how to overcome those, whether it's a medical practice or whether you have a product that you want to put up there. And I understand, and people are free to have my email. I will assist anyone trying to find financing or has any questions because I know what the struggle's like. And not only are we bankers, but we're operators. And that's what makes us different. We are the guys who, and myself, I was telling Jacqueline, I came up to Alaska for the first time this year, and I've been coming up more and more. We're hands on. We will open the boxes, put computers together, desks together, but we also know how to write business plan, financial plans, put strategies together. So wanted to start off with the first thing, which is starting a business in Alaska. I've started hundreds of businesses for different clients, meaning everything from the LLC paperwork to the operating agreements to putting together their state tax registrations, IRS registrations, whatever it might be. Those are the easy parts. A lot of people, when they start a business, they will go to different professionals and try to spend money. It's very simple to start your business and the paperwork for it. Have everything together. That's the first thing. If you want to go to a professional, find yourself a CPA and find yourself an attorney that specializes in healthcare or medical, whether it's a product or whether it's a clinic. That way they can properly set you up. If you're not properly set up, when you go into the banks, try to get financing or do things for the future, you're going to find you're going to stumble and have to change paperwork. And that's the biggest problem. The second part goes into also finding somebody who knows how to do all the licenses. That means whether it's your medical practice, whether it's insurances, have somebody that's very good administratively. You need a good team. That's the first base. And if you set the foundation up, even let's say you have a product, an idea, just you don't need to hire 20 professionals. Hire 3 or 4 professionals. That's it. Have a good team. It's about saving money and building. The next part about it is that we found that once you start the business in Alaska, a lot of people are in Alaska. But for us, we found that there's a lot in Alaska, but a lot of people in the lower 48s trying to get into Alaska. And that's the biggest part, which is financing. Some people in Alaska will come there and they have the funds. If you have the funds, great. But the biggest thing is don't build a Taj Mahal, build what you need. Start with a strong financial plan. Know what your budget is. I could send people free budget sheets, free pro formas, projections. I will gladly help anyone with that because I love seeing people succeed. But have that. And so know what you're doing, spending, whether it's your internet bill, electric bill, all the way down to your supplies. Have that and if you have the cash, make sure you don't overspend. If you're going to finance, know where you stand, your credit reports, know think outside the box. There's a lot of grants. Go sign up at sba.gov, grants.gov. and find the grants. If you're in Alaska, there's a lot of grants for people in Alaska, rural Alaska, especially in medical and healthcare. All you have to do is take the time to do the paperwork. If you spend a week doing paperwork, you can get what you need. That will sustain your company for 6 months to a year, guaranteed. Now, the other part is if you don't have the financing, it's okay to get investors. There's people who put up their homes, their cars. People do different things in order to set up their businesses. If you have an idea, there's a lot of people out there that are angel investors. A lot of people, a lot of times, come to us for investments. We do angel investments sometimes, but know what you're going with. Have that strong business plan, that financial plan, have a strategy. They also want to see exit strategies. What is the worst case scenario? So even if you don't have the money, but you have an idea, or if let's say you're a doctor that wants to put a clinic together, or you have something that's innovative, let's just say a med spa, something, but it has a need, have it together. And there are people out there that will invest in your dreams and your ideas. So even if you don't have money, but those are two scenarios inside Alaska and outside of Alaska. The next thing that we ran into was employee hiring and retention in Alaska. We're still dealing with it. Finding CMAs. I hired a CMA that I had to let go because she didn't tell me that she worked for one of our partner clinics. She walked into the clinic and they said she can't work here. But we've had a struggle finding good CMAs. Sometimes providers. We've had issues. Even doctors. A lot of them we've been bringing from the lower 48s. We had 2 neurologists come up from California. We have another one coming from Maine. We have my cousin who hopefully will be coming in a couple months, who's in internal medicine, but got stuck because of COVID. There are people who want to come to Alaska. Give them an incentive to want to come. And the people who are here, give them an incentive to want to stay. Because that's the biggest problem that we've had is employee retention. But once the right people are there, they will stay and they will be loyal. And that's the thing. Alaska is not the third world country. People in the lower 48s think it is. It's beautiful. It's different. But bring them up there. Show them. And make them happy. Every time I come up there, I buy my staff lunch. My business partner, we go in there with a smile. It's just the simplicities of it. But that's one of the biggest issues in Alaska, I think, is the employee retention and hiring. The next big thing is marketing. We spent a lot of money on marketing in the beginning. That was not worth it. And I'm being bluntly honest, but you know what we did? We did find certain marketing skills and companies that will do the marketing for the right price. Look at what you're doing. Do your research. If you're a small clinic, you could spend $2,500 to $5,000 if you can afford it, and you could get the patients. There are the patients in Alaska for the clinics. Urology, for example, we're looking at adding that on. There should be 1 urologist for every 25,000 people population. Right now, it's almost 35 to 40,000. Primary care, after COVID, 9% of the primary care providers or so in Anchorage are not returning. There are the patients, there are the people. Then it's not just Anchorage, it's Fairbanks, it's the other parts of it. Is that if you market in those areas, people will drive down. Do it on the radio for cheap. Do it on the internet. People research this, but do strategic marketing for the right price. And that's the most important thing. But do marketing. Otherwise, people won't know who you are. That's one big thing. The next thing is strategy. You could build a business. You can have a product. That could be great. I had a guy who worked at DuPont. He had nanotechnology fibers. His strategy was not the best. We had to reinvent his strategy. Because the problem was he had a great product. He just thought that he was the greatest thing in the world. He wanted to do it his way. We had to show him over time that you have to do this by strategizing, partnerships, having other companies you work with. The only way to get your product out there is have the right business consultants and hire a strategist. One of my degrees is actually in strategy. And we learned if you don't set yourself up, not just a financial plan that's 3, 6 months, a year, but say, this is what I want to do. You don't want to just think Alaska. You want to think nationwide and worldwide because you're part of the United States. But if you have a product, you know it could revolutionize and there's people outside of it. It costs nothing to ship products. It costs nothing to network. But if you're in Alaska and you're a healthcare provider, best thing to do is, besides everything that I mentioned, is have the strategy of growth, but also the strategy for your patients. What gives them retention? Doing little things, follow-up emails, happy birthday cards, littlest things. Strategy is about how you not only sustain your business, function it, but in case of the worst case, what happens to your business, which is my last point, which or second to last, which is what do you do for exit strategies? Sometimes people sell off businesses. We had a company in Alaska doing really great, is in a certain market, but we were looking to put a business. We are a little bit more affluent and can do a competitor and win it. We said, hey, we're willing to partner up with you, but this is what we're looking for. But he wanted to sell for more than what it was worth. Sometimes you have to look at your exit strategies if you have a product or a business. Even if you have a clinic that's failing, do it the right way. Have exit strategies. If it's failing and you want to try to sustain it, reach out to help to people who are business consultants or strategists who know how to fix the business and look at the little finance of it, because every little part helps. Every $100, every $1,000 helps in a business. And it goes on both ends. But that's in a really short synopsis, that's what I've seen in Alaska, but for products and clinics and what to do from start to finish. And the biggest thing that I've seen, and this goes to my biggest point, is networking and everybody working together like this presentation. And that's the biggest part, is that if people work together, there's enough money, there's enough patients, there's enough business to go in and outside of Alaska. And that is the biggest thing people need to do. And I think there needs to be more networking possibilities, both in Alaska and to present it for people like myself that are in the lower 48s. And
awesome. Thank you, Raj, very much. So
that's what I would say.
So we're kind of a collection of change makers. Probably all of us will continue to be in healthcare. We might not run clinics. Can you tell us how, like you were planning on bringing a dermatologist up or a urologist, that clearly would affect us, right? I mean, if you've ever had a family member who's had to travel out of state in order to receive services, you understand the value of having some of those specialists here. How do you retain doctors and bring them here and help share about the lifestyle and the reason why they might want to locate in Alaska?
Well, and we do a mixture of things. Some of the professionals come for part of the month and then go back, and you have providers, nurses, NPs who are there. Others, we have to physically bring them up there. A lot of people we've seen have been from, let's say, states like Maine, Montana, Idaho, who understand the climate. It's hard to bring someone from Miami to Anchorage. But are there a lot of professionals that are in California or even other parts of the state? We fly them, we talk to them. And it's very difficult, but it takes time. But there are those professionals who want to move. And it's not like there's certain parts. You go to the North Slope, of course, it's going to be cold. But if you go to Anchorage, it's not always cold. You have to let them know, and you have to physically show them. And it's a process. It's not just we'd like you to come up here. And then they get to meet the people. They understand it. Everything from cost of living, salaries, to the climate. And then most of all, the people.
Thank you. Now, you were telling, I'll let maybe other people ask questions, but you were telling me previously that COVID really affected your business model. Do you maybe want to speak to that, and then we'll open it up for more questions?
It did. For example, with access to care, we are switching that over to internal medicine and becoming a part of Denali Healthcare. I'm just going to be honest. And we are also having some mergers and making bigger companies. What it was that even though COVID did affect us, we started December 2019, I was able to sustain. It's a little bit harder because the government wasn't as proactive with newer companies, but even with ourselves, we relocated. We understood that COVID had to shut us down for a little bit. COVID testing, for example, we had to deal with Walgreens and we had to deal with Walmart's doing COVID testing. Vaccines, we bought vaccines, but people went mass numbers to different places. We had people that were what ifs. We had to adapt. And even now we're still adapting. In the newer clinics, I'm working on the legal side, which is the masks, mandates, and vaccines. And we have to see what happens. Adaptability is the biggest thing, but we understood, and I planned for worst case scenarios as a strategist, being a banker too. So most people, it's very hard because they were shutter businesses. We had a little bit more fluency, but at the same time, we understood it. And it was a struggle. And it's harder being in the lower 48s to work in Alaska and to expand. but we did. And we figured the best way is let's switch. We can still do what we do, but on a different specialty side and adaptation. Even for products, this with innovation, some of the companies you sent me, they might have where their warehouses were closed, or they might have had to deal with COVID. COVID might be a temporary thing, but it doesn't mean that in business you always have to adapt. That's why I tell people build a 5-year financial model. Doesn't mean it's going to be a financial model. The first year to 3 years are realistic, but the first year is realistic.
Understood. All right. Thank you, Raj. I'll open it up for other questions. Is there anybody on today that would like to ask a question?
So Raj, my name is Lizette Steer, and I work with the Trade Association for Providers of Developmental Disability Services. So we do residential, group homes, assisted living, and then all kinds of other services as well. And I'm curious about if your toe has been dipped into those waters in terms of helping people initiate those kind of programs. Have you had any experience with that at all? Would that be something somebody could reach out to you for?
You mean with nursing homes and healthcare?
I'm sorry, say that again.
You mean with assisted living and nursing
Yes.
homes?
Yeah,
Yeah, actually, as a matter of fact, we do have some expertise in that. Where yes, they could reach out to us depending, because up there, obviously they're called pioneer homes, and we've learned a lot more. In the lower 48s, we have experience with that. Now we understand with COVID, we have quite a few friends in that industry, lower 48s, and they've reached out to us as far as how do we deal with this? What do we do not only on the legal side but on the financial side? And that's where we specialize more. As far as providers, yes, we have providers who can come up to it, and we are actually going to start working with that to go more into, especially with the urologists we're speaking with. And we know for neurology and pulmonology, visiting them is one of the biggest factors because transportation is a huge issue. And so we're looking at how can we get the doctors and the providers to the nursing homes. Feel free to reach out to me. I know on the legal and the financial side, I can give you quite a bit of information, as much as I can.
Okay, thanks.
Thank you, Raj. Am I to understand, Lizette, that this would be helpful to have just more providers able to meet people with who are seniors or with developmental disabilities? Would that be helpful to you and your association?
And Jacqueline, I'm thinking about it from two different perspectives. And one perspective is, at this point, a lot of our existing programs are, of course, experiencing dramatic fiscal shortfalls based on ability to bill and infrastructure that requires expenditure that they can't really bill the same amount of services for. So like programs being able to refinance or strengthen. And the other piece to me that might be of interest is like smaller people who are interested in just starting out. So it wouldn't be the big programs. It would be small, like an assisted living home that wants to start.
Awesome.
Yeah, actually, we do know quite a bit of companies that do that. And luckily, we have a pretty good network, referral sources, I should say, and that depending on it, because you have different types of assisted living, nursing homes. You have to, it's very specific.
We're not so much in the nursing home business.
Yeah, so depending on it, yes, we do have it where we can connect people that want to restructure, start out, depending on where they're at, looking at asset bases. We've had, God, over the last 7 to 10 years, I probably have seen a lot more than I can remember. So feel free to send it my way and I'll see what I could do to arrange some referrals.
Thanks.
Awesome. I'm happy to do that. Are there any other questions from anybody online today? Well, I always have questions. When you are looking at providing care in Alaska, are you looking at a value-based care model or a fee-based model right now?
Actually, more of a fee-based model, and there's a reason for that. having grown up in the medical world, I've realized that, it's always about the patients. But the states that we're in, and I would say especially fees, is it sustainable? If you're going to do a business, you have to see if it's sustainable. For us, it was about the fees and what the reimbursements were, but also, was it not just that, were there the patients?
Mhm.
And there's enough patients out there. The other problem is finding the providers. It becomes more difficult than anyone could have imagined. And there's the hospital, and then there's the private providers. And in the private providers, you have the big groups and the little groups.
Thank you very much. So we're about down to our last 5 minutes, but we always ask what we can do for you. So maybe you can wrap us up today by answering that question.
It goes to my last point, which is that I'm here to help, but the biggest thing is everybody needs to network and everybody needs to work together, because even though we might be in different fields, or let's say not, or maybe even competitors, there's nothing wrong with connecting.
Absolutely. You're speaking our language, Raj. That's what we're all here to do. So thank you so much. Well, I want to say a big thank you. Do you want to tell us a little bit about what Klondike Partners will do?
Actually, Klondike Partners is our business consulting firm. And it's something in St. Louis, Missouri that we are networking out, and we're redoing our website. And it has very well-rounded investment bankers and attorneys that our biggest thing is we're here to help businesses. And we're going to expand in Alaska and help Alaskan businesses as well.
Will it be specifically for healthcare?
No, all types of businesses.
All types of businesses. Okay, but since you have a background in healthcare, if we had healthcare businesses, because we often have entrepreneurs who are starting out, and we might be able to make connections that way.
Yes, and on our new website, we will have the fields that we specialize in, and if we don't have something that somebody needs, we can refer them to somebody probably. So we are somewhat specialized, but we always like to help new entrepreneurs, and if it's in the fields that we're experts in, we will definitely help.
Awesome. That's wonderful to hear. Well, thank you so much, and we will certainly keep you in mind. I'll make sure to connect you to Lizette and anyone else who wants to be connected. And thank you very much for your time today, Raj.
Thank you, and thank you, everyone.